So we are here today to present to you these Dopplers to hopefully make your work a bit easier and improve the quality of care that you provide. Hello, welcome back to the channel. Thank you for tuning in again. And if you are new here, thanks for stopping by. So this video, as you can see from the beginning, is all about the Fetal Doppler campaign. And I'm glad to inform you that the campaign ended and we have distributed the 30 Fetal Dopplers to 30 health facilities in the most rural areas in Ghana. As some of you may remember, last year, September, that is September 2022, I came to you launching the Fetal Doppler campaign. The whole aim was to secure 50 Fetal Dopplers for midwives who are based in the most rural areas in Ghana. But we couldn't get the 50 Dopplers, but guess what? We were able to raise funds to buy 30 Fetal Dopplers for 30 health facilities. So before I go on to explain how the whole Fetal Doppler campaign was planned and executed, I'd like you to listen to the feedback of some of the midwives who are using the Dopplers.
So many of the times where my facility, which is a health center, has always been in need of fetal Doppler to assess the well-being of the fetus in utero during antenatal and of course in labor. And one of these numerous reasons was for confirmation. So sometimes we encounter fetal tachycardia or fetal bradycardia, and we've needed the fetal Doppler to confirm, to get to know what is actually going on. And again, the Fetal Doppler has always been in need because we always want to involve our clients in the care. And with the Fetal Doppler, it is known that the FH is heard aloud, and we are able to educate the mother with that is the FH, the fetal heart rate of your expected baby, and with that, they are able to assess the well-being of the fetus with us. So these are some of the many reasons why we've always wanted a Fetal Doppler. But in recent times, we have, as a unit, we have acquired a Fetal Doppler, and of which we are very grateful because it is helping us to execute our tasks diligently and accordingly. And also, our expected mothers are verbalizing that they are in less pain whenever we use the Fetal Doppler on them, which is making our work very easy.
And I will form pa. The Mamma chess, I was so pa, I blew 160 and I said, no, doctor. Now, will form pa, do 120 and I said, oh, doctor. Until I say, I for an home, and I'll come on and say, when they say I go 50, 120, you could see 160. You move back and I say, I for an soon. It is a war form and I cost so pa. And say, my doctor is sure. Let be able to show one thing for an car. Say, oh, bad woman midwife, no more who doctor, walk with us, can you who sat around the woman you were hope. After the next so, I need to take it, use I did fetal stethoscope, and I did check in for an home anyway. But I say, I am ready, and I fetal doctor, I bet for dear Abba. I don't know, you use to a day share or banner fruit. It's in a home, a son and a home, and a year to my phone. Now, when so I dig it time, I have for the 1 10 10 10 10, a very effective, accurate, they do my yellow, a some punching. First, the end of fetal stethoscope. It's I don't know, I have one my midwife so to me, and then share a parana, or that will fill me send out more day, and then come and send me see air buff. It's adophobia, no more do me no more a day. I check it fair way or more Eddie brain. It's here that we thank all the donors who contributed in all the diverse ways that which we are women and they should be in the center. Yes, you have Fetal Doppler yi bi. Yes, you dey hwɛ yɛapemfo ɛne ɔmo ba bɛwo wɔ yɛn nsam. Yɛda ɔmo nyinaa ase.
Well, one of the midwife at the health center. We are coming to assess our client's fetal heart rate. We've already done the examination. So at first we used this fetoscope to check fetal heart rate, which mostly takes us 2 to 3 minutes before we can even identify the back end and listen to the fetal heart rate. We now have this modernized fetal Doppler, which has really helped to reduce our work load. So I'm coming to listen to the fetal heart rate with this. So as we see, yes, so I was able to detect the fetal heart rate within a second. As compared to the other one, you have to locate the fetal back, you stress yourself and stuff. But this one is pretty easier to check the fetal heart rate. And even in case of fetal distress, you are able to detect it as early as possible and then prompt referral immediately. I was able to even detect it less than a minute. So this has really helped us. And even with the ANC, it's easier, it's faster. Sometimes we have 20 clients and stuff using this one delays time, but this modernized fetal Doppler it attend to them as easy so that they can go to prevent delays. We thank you so much for this Doppler. It has really helped us and we will keep it in good condition. We are most grateful.
My name is Abedua Belson. I'm a midwife at the Sofa Park Clinic in Ashmore district of the Ashanti region. We are privileged to be part of the clinics that were selected for the Doppler distribution in the region. The receiving of the Doppler has actually gone a very long way in helping our care delivery. We are in a very noisy environment, so using the peanut was causing a whole lot of issues in our auscultation. Getting the Doppler has actually transformed our work and improved it. It is really, really helping us, and we are so grateful to you and your team. Thank you very much.
I would like to stress here that these fetal Dopplers that have been donated, we are not saying do away with the traditional fetoscope or peanut that have been used for so many years now, but rather these fetal Dopplers will equip the midwives to be more efficient, to be more accurate, and to be faster, and also improve the quality of care given to pregnant women during pregnancy and delivery. We would recommend that the fetal Doppler is used alongside the fetoscope or pinard because we are aware that not every midwife has access to a fetal Doppler. And also, the Doppler is an electronic equipment. So if for any reason it's not working or the batteries are low or whatever, you can always use the fetoscope. But the fetal Doppler is there to make you more efficient and be more faster. If you look at the maternal and child mortality rates all over the world, we are aware that the rates in the developed countries are low and that of sub-Saharan Africa is very high. The issue of stillbirths, that is babies dying in the womb before they are born. Sub-Saharan Africa accounts for the highest rates, and this ought to change. Midwives in the developed countries are using technology, they are using modern equipment to deliver care to pregnant women. And when you look at our midwives in the rural areas, most of them lack very basic equipment. And therefore, we believe that these fetal Dopplers, in a small way, will enable the midwives to be more efficient, accurate, and faster, and also improve the care that they deliver to pregnant women during pregnancy, labor, and delivery. How did this whole campaign start and how was it executed? I'll stress on the word collaboration. And if you're an African diaspora wanting to give back, it's really important to first of all do your research and network, connect, reach out, and that is going to help in a lot of ways. So, right from the beginning, we were liaising with the Ghana Registered Midwives Association and also liaised with a key midwifery consultant in Ghana, Dr. Mrs. Jemima Denisenchi, who was also instrumental, in the whole area of collaborating with our, counterparts in Ghana. Right from the beginning, we were liaising, through Zoom calls, through telephone calls, through WhatsApp chats, through Telegram groups. We set up a Telegram chat group for the midwives. And most importantly, we're liaising with the midwives one-on-one from wherever they are in their stations. So it's important to do all that groundwork. Just a little bit about how we came up with the list. So myself and my colleagues, that is Lucy, Josie, Doreen, and Davina, we had liaised with midwives back home and we came up with a list of 15 beneficiaries. And this was scattered all over the country, in Northern region, Volta region, East region, Greater Accra, Ashanti. So when we liaised with the GRMA, they recommended that we focus on one region. So they came up with a list from the Ashanti region, and this was health centers in the rural areas. So they gave us the list in all, making 30. So this is how we came up with those that we felt, needed those Dopplers. And also, I should stress that we are using this as a quality improvement project. And we are aware that, sometimes you hear organizations from abroad, they go to donate equipment and then leave them. And there is room for that. There are some equipment that you just need to go and donate for people to use it. But there are some that we feel that is good to follow up and see what impact it has made. So these Dopplers that we sent, we are not just giving it and then coming back and relaxing. We are using it as a quality improvement project. So from the beginning, we had 4 questions that we asked in terms of how long it takes to check the fetal heart rate with the old, how many fetal distresses they have, how many referrals are made, and how many stillborn happen in a month or in a year. So we collected this as a baseline data, and the plan is from after 6 months to 1 year, we'll repeat the same questions to assess any difference or any impact made. So in a sense, we are monitoring and we are following up to see what is happening, and then we will review it. And then the ceremony itself, it was such a beautiful ceremony. The midwives were invited to a popular hotel, which I'm told that they normally hold workshops there. They came. And I also want to acknowledge a couple, Ghanaian couple, that were also in Ghana. And I had the privilege of attending the ceremony with them. He's a Ghanaian dentist and his wife dentist who are retired, based in the UK, but they do a lot of, charity work. They want to remain anonymous. I went with them to the ceremony. So the Dopplers were actually distributed there at the ceremony one-on-one and then signed for it. It was nice to hear that such a portable equipment will make a whole lot of difference to their practice and they were so grateful. So, what is next? The next campaign, we are going to appeal for more Dopplers, and I hope that when we come back to you, you'll come on board and you support this campaign. We want to improve the care that our pregnant women in Ghana, not just the rural areas, but everybody. And even if you're a man, if you've had a child or you've had children, you will know what women go through, and you know that they need that quality care, and they need to have safe pregnancy, safe delivery, have their babies, their expected babies, with no mishappening. So yes, thank you so much for listening, and thank you for watching. And as I said, we'll be coming again with another campaign so soon. So watch this space. And before you go, hit the subscribe button and help this channel grow. It's all about giving back to Africa, and it's all about our folks back home. Thank you for watching.